Welcome to BW Healthcare World. In our series where we are talking about quality and patient care, we have with us Dr. Parivalavan Rajavelu, who's a consulting surgeon at Sundaram Medical Foundation and is also the founder of SkillsForMED Patient Care Skills Training in Chennai. With a lot of affection in the industry, he's known as Dr. Pari. So we'll address him as Dr. Pari. So Dr. Pari, welcome to BW Healthcare World.
Thank you. Thank you for having me here.
Dr. Pari, my first question to you is, when we talk about quality, patient care, safety, one is the safety from the surgery point of view, from the doctor's point of view. What I want to discuss with you is the medication safety. What exactly is medication safety? And how has the journey of medication safety evolved in the past few years in our country?
Yeah. See, as you rightly pointed out, medication safety is one aspect of the patient safety. Patient safety is a whole gamut of strategies to reduce harm to the patient. And the medication safety focuses on medications. Two things are there. One, the medication should be used effectively and also safely. And finally, we are doing this to optimize the patient outcome, but at the same time, minimizing the risk of medication-related errors caused to the patient. So the most important thing in safety is not causing harm to the patient. So when we give medicines, of course, there will be side effects and all that. So how do we minimize this harm? So that is, and how do we effectively make these medicines as effective as possible? So this is what medication safety involves. And it starts from the national level and goes up to the patient bedside. You are asking about the journey of medication safety in India. Actually, pre-2000, when we were doing our undergraduation and post-graduation, it was not a concept at all. We didn't know anything about medication safety or even patient safety for that matter. So pre-2000, it was totally an unexplored concept in India. The early 2000, people who came back from the West, doctors who came back from the West, they saw how this concept was being practiced. And individual hospitals, in small islands, this was being practiced. In our own hospital, I was the first pharmacy committee chairman in 1995. And we introduced restricted antibiotic policy. We also made a small hospital formulary. So this was done bits and pieces. But the real journey started on a broader national level in 2006 when QCI introduced NABH. And NABH manual had a separate chapter on management of medication. And whoever was getting accredited had to go through this chapter and implement certain medication safety related matters in their hospital. And in 2013, the government introduced the National Coordination Center for Medication Error Reporting. This is basically a pharmacovigilance body. So it looks at the various hospitals, looks at medication errors and all the adverse events, and the reporting system started. Though it started in 2013, I think it caught fire only in the last few years, and this reporting is taking place. Though I'm from CAHO, I don't want to boast, but I feel CAHO had a very major part in spreading the concept and implementation of medication safety in various programs. And recently, last year we launched the medication safety workshop, which is a two-day intense workshop for all the healthcare professionals. So I think last 3 to 5 years is where medication safety is really coming to being in India.
Right. You spoke about medical errors.
Yeah.
What are some of the errors that happen during the administration of medications? And what causes these medication errors?
Yeah, actually, traditionally, medication errors are looked at as if they are happening only in the hospital. So we have this medication workflow where the doctor prescribes, then somebody transcribes the order onto the order sheet, the pharmacy dispenses it, the nurse will administer it, and finally the monitoring is done jointly by the doctor and the nurse. So errors happen mostly in this cycle. So majority of errors actually happen in the medication administration part, but also prescribing errors can happen when the doctor writes, As you all know, doctors have poor handwriting. So when the written prescription was there, it was a very major cause for errors. Now with electronic prescription, it's getting better. Transcription was another important part because doctors were just used to do the rounds, verbally tell and go. And the nurse or someone used to transcribe it. So whenever there is a human involvement, there is error. So now we ask the doctors directly to enter into the medication chart, thereby eliminating the transcription error. Dispensing errors can happen in the pharmacy. And nurses, when they're administering, a lot of errors happen. So we talk about the 5 rights, the right medicine, the right patient, the right route, the right time. And these things have to be, there are so a lot of errors which can happen in any of these 5 things. But actually, if you look at it, it's not only happening in the hospital. It's happening also in the drug manufacturing. As you know, India has got the largest number of brands in the whole world. So there's a lot of confusion, about brands and also the manufacturing, good manufacturing practices, though it is in paper, how it is being implemented in individual industries, we don't know. Environmental factors, for example, vaccines are affected by temperature, equipment and technology failures, and labeling and packaging issues are a big issue. So we have this concept of look-alike, sound-alike medication, LASA for short. So certain, you might have noticed, when you buy medicines, the strips almost look the same, but the medicines will be different. There'll be the blue color, red color, it'll look the same. And sometimes the names are also very alike. So this look-alike and sound-alike medications again cause a lot of errors. And the other important factor in the hospital is systems factor. That is, individually, whenever an error happens, immediately we jump on the nurse or immediately jump on the doctor who's not prescribed properly. But of late, we have realized it is the system or culture in an organization where we have to encourage reporting these errors. Only when the reports come to the surface, we can learn from these errors. So that is another major factor where very tightly controlled or very authoritarian sort of thing in the hospitals, nobody would report. And finally, patients themselves are causes for errors. They don't take medicines on time, or they may actually have cognitive impairments. They may not understand the language, or they may not have the literacy. So these in toto are the causes for medication errors.
I completely agree with you that culture is a very important aspect, and while accepting mistakes, or is it okay to make mistakes, is welcome in today's industry, but in the field of healthcare and medication, this could have a very deep impact on the patient outcomes. So I think that is why it has to be very regulated, and we need to be really careful in terms of avoiding errors. And Dr. Pari, do you think, you spoke about LASA, you spoke about various other aspects of medication errors. Do you think there is a need for standardization for medical safety? Because, when you talk about medical safety in a country as large and as diverse as ours, the interpretation of medical safety could be itself an issue. So what do you think? Should we need a standardization on medical safety? What is the responsibility of the doctors and also the healthcare practitioners or professionals other than doctors who are a part of ensuring medical safety, medication safety?
Yeah. Actually, no, it is the need is over, but it is a long journey. It's more of a marathon than a sprint. And we have made a beginning, I think. In fact, having this interview itself is one I think message. We are saying that it is something to be discussed. And WHO says that we need to have a multimodal approach. No, not one approach works. So I just wanted to share my experience in the UK. Now, when I went to the UK and practiced there, every doctor or will have in their coat pocket the British National Formulary. So, and even in the OP or in the IP, and there was no shame. When a patient was sitting in front of me, when I had to write the drug, I used to open the British National Formulary, make sure I am writing the correct name, the correct dose, and then only write it. Culturally in our country, if I do that, then they'll say, this doctor doesn't know anything. He's referring from the book. So the culture is very, very important. right? So this, as I said, is a small country. So they were able to standardize nationwide the British National Formulary. It was across the hospitals, the only formulary which was followed, and everybody, used it day in and day out. But what is our government, has passed in Ministry of Health and Family Welfare has done a lot of work in the last few years, but there is no national formulary. Okay, so that is something which we need to work at. And the restriction of brands, as I said, India has got the largest number of brands. I don't want to get into this thing about generic medicine which is going on. That is a totally another chapter which we won't get into. But at least restrict the brands. Implement the good manufacturing practices, transportation infrastructure. Of course, accreditation is voluntary now. So as long as the hospital is getting accredited, it goes on. So these are all helps to standardize. But what I really want our country to embrace is the information technology. It has been shown that IT really reduces medication errors. In fact, in healthcare errors in general. So electronic health records, and there is a thing called computerized physician order entry system. So it will prompt us. Suppose I write a drug which is interacting with another drug. So the computer knows, it will know that this drug is interacting. So it will prompt us saying, this drug has an interaction with this. Do you want to go ahead? Or the patient already has got allergy for this. I think we need to look at the alternate drugs. So this sort of alerts come up in these CPOE, that is computerized physician order entry system. The other thing which India, I'm sure, Nandan Nalkani is working on is the stacks, India stack. So of it, the national health stack is being developed. And I am very, very, curious to look at how this will increase the interoperability between the various HID. If I move from one hospital to another hospital, I cannot take my patient data. There is no interoperability because there are individual vendors who are providing these systems. So when this national health stack comes, I'm sure the interoperability will improve. So that also will standardize. There are also the system of barcode system, where we compare the patient risks, they have a barcode, and I have my prescription a barcode. So the nurse will just scan the barcode, make sure it's the right patient, the right drug, and all that, which is being practiced routinely in the West. And barcode is not very expensive. Now it's not available. So all these technology-related things also will standardize medication safety. The other thing you asked was the responsibility of doctors and healthcare professionals. Yes, first starts with the doctor. Rational prescribing. This is a huge topic. Rational prescribing is writing the right medicine for the for that patient in the appropriate dose, not overusing or misusing it. Antibiotic abuse and misuse is a major problem in our country. So that starts with the doctor. Then medication reconciliation, that is, patient comes to the hospital. We need to know what are the medications they take at home. Reconcile with what you're going to give them in the hospital. This doesn't happen. Sometimes it happens at discharge and in admission. But every transition of care within the hospital, this has to happen. So this is the responsible healthcare professionals. Nurses, as I told you, follow the 5 rights. And there is a thing called triple check, where they check the medicine 3 times before giving it to the patient. And all the junior doctors and newly coming nurses should have training on this. And of course, the public also needs to get in. Patient engagement will again push the standardization happening in our country. So as I said, it's a lot of breadth, a lot to do, but I think we need to get it done.
Got it. And Dr. Pari, what are your thoughts on the OTC medication, over-the-counter medication? How can medical safety be regulated in this scenario, especially in our country where people just go to a chemist rather than a doctor and ask for a medicine for the symptom that they're facing? And what are some of the basic do's and don'ts? Also, if you can share, since you brought up the labeling issue, that what is it that the patient must do while reading the labels, and also disposing of the medication. I mean, there is a lot of unused medication that is there at home which has expired. I don't know what to do with it. and many of these medications just land up in a charitable institution.
Yeah. Yeah. See, regarding the over-the-counter medication, actually, I have changed my views recently. I was brought up with the thing saying it's totally, not good. We should not do it. But then, after reading the pros and cons, I don't think we can totally criticize the practice of over-the-counter medication, because we need to have a balanced view. I'll tell you why. Because, in India, we have socioeconomic issues. If you come to a doctor, they have to pay the consultation fees, and they may not have the money to buy the medicines. And also, people from remote areas may not have access to a doctor or a healthcare facility at all. So this is where the pharmacies come in. They go to the pharmacy, they tell them the symptoms, and then they get some over-the-counter medication. So for simple ailments, I think this is okay. Advantages, as I said, it's convenient, accessible, cost-effective. And actually, if you look at it, it will reduce the healthcare burden. Simple ailments are actually taken care by this practice, and also there is prompt treatment. But there are a lot of disadvantages. Mainly, the pharmacist or whoever dispenses the medicine may misdiagnose, may miss a major illness, and again they also may misuse and abuse, and antibiotics and other drugs. And because the patient gets symptom relief, there's a delay in treatment, and they may end up in a much bigger problem. And also there's no monitoring. The pharmacist just gives the tablet and patient goes home. So this is, as I said, a complex issue. So we need some regulation on that. Maybe we should have a selected list of medications which the pharmacist can only give over the counter, which is most Western countries do that. So that is something which we can start. And the other thing is the do's and don'ts for patients while taking a medicine is first to read the label, right? I told you about the 5 rights for the nurses. Same thing can be said for the patients. First is it the right medicine? Check the name with the prescription. Make sure you're taking the right medicine, because there may be dispensing errors. The pharmacist might have given the wrong medicine. So check the medicine. Then the dose and the time, how many frequency, is it morning, afternoon, night? The frequency also has to be taken properly. And the most important thing is to check the expiry date. So when you buy itself, check the expiry date and make sure it is at least 3 months before when you're buying the medicine. Most pharmacies have the system of returning near expiry date medicines, but some may get into the system. And very important is the right storage. See, in the hospitals, it is mandatory for every pharmacy to have air conditioning, because medicines are said to be stored at room temperature. So room temperature, by definition, is 24 degrees C. You can imagine in Chennai, in peak summer, the community pharmacies, are just open. None of them are air conditioned. So we really, have a problem there in community pharmacy. And also when you buy the medicines, certain medicines are very temperature sensitive. For example, insulin, that has to be stored in the fridge. So read the instruction carefully about where it should be stored, and read the label and read the insert. It will be there regarding storage. So these are the 5 things which the right medicine, the right dose, right time, right expiry, and right storage, which they should do. You pointed out a very important issue of wastage medication, remaining medicines. It's absolutely a huge problem. It's a biomedical waste, which is tablet waste, which we don't know where it goes, because people just throw it in the bin, or they may give it to, as I said, to some charitable organization. Whether it's effective, it's expired, we don't know. We need to have a return program in every pharmacy. So there will be, a bin, in the UK, there will be a bin in every pharmacy where patients, if they have remaining medicines, they can come and do it, and the pharmacies will sort it out. And also there will be, pharmacy return day. The hospitals will run, Mela, return your older medicines, once in 3 months, like that. So these are things which we need to do. Hospitals and pharmacies that get into the act to reduce the medication waste. Municipal corporation now are getting into the act, so they can also tell the people to dispose medicines separately. A very interesting instruction given by FDA is whenever you are disposing medication, mix it with an unpalatable substance like coffee or some bitter substance, and then seal it, because even dogs and cats can eat these medicines and get sick. So these are all things which we can do to eliminate the medication waste, say, and make it safe.
No, this is really important because while this may be happening in a very unorganized way, there has to be some procedure that is to be defined and set and put in place and executed for this. My last question to you,
a program for a Rotary or Lions to start, to just get the return medicines with link up with some pharmacy.
Got it. And Dr. Pari, my last question to you is that for over a decade, we have been trying to establish teleconsultations, e-prescriptions, telemedicine, but post-pandemic, this has really fast forward and sped up like crazy. And as we have evolved with an extensive teleconsultations and e-prescriptions, which are extremely important for our country because access is a problem, what is the responsibility of the healthcare industry as well as of the patient while using teleconsultations and telemedicine?
Right. Actually, the Ministry of Health and Family Welfare website has got its document, Telemedicine Practice Guidelines. As you said, it was issued early during the pandemic, somewhere in March, April 2020. They did it as a hastened it forward during the pandemic. But it is an excellent document. It gives clear instructions to both the healthcare and the doctors how to do this telemedicine as well as to do the e-prescription. So if you want to quickly summarize, the one is the accuracy of the prescription. It is the responsibility of the doctor before he hits the enter button to send to the patient to make sure, doubly check that the prescription is accurate and it is for the right patient. Very major issue is security. I'm sure you would have come across newspaper articles of how patient data is being freely available because hospitals don't put the security systems in place. So very important to make the patient privacy secure, and integration into the existing most of the telemedicine or e-prescription or standalone again. They don't integrate with our HIS or other systems, hospital information systems. So that's very important. And from my point of view, doctor point of view, because when a patient is sitting in front of me, very easy to verify the patient. When a patient is remote, it may be the cousin or wife or husband who's actually in the camera. So I need to make sure patient verification is good. Similarly, the patient should authenticate the prescriber. Both ways is important. There may be some quacks who can take advantage of this telemedicine. Already they are rampant all over the rural areas. So this is another avenue. So the prescriber authentication, are they from a genuine hospital, is very important for the patient. So we need to do a lot of patient education on that. And patients also need to give full information, because in teleconsultation, we would the conversation is very easy. I mean, in a face-to-face consultation. So in a teleconsultation, they have to be doubly, sort of conscious to give the full information, and also remember to access and print it. See, all said and done, having having it in the phone, sometimes you may forget to take it or you may not check it. So it is, I think, is a good practice. I know it's wastage of paper, but it's a very important thing. Still, the people get used to this telemedicine or e-prescriptions, print it, and any problems report it. And most important is engage yourself. I'm telling the patients, engage yourself in the whole treatment, because you're not actually gone to the hospital. So you may be casual about it. So this is a cultural problem or a new thing which is coming into a thing. You sit at home, so you have a casual attitude. Whereas when you go to hospital, you'll be very serious about it. So this engagement is very, very important for patients. And also patients should insist on the privacy being safeguarded. So I think I made it very short, but this document is freely available. You just have to Google telemedicine practice guidelines and it will come on the first page.
Absolutely. Dr. Pari, this is a very important aspect because, the two things that come to my mind when I'm talking to you is one, when you're on the screen, while you are just looking at the patient or the doctor, you do not know who else are there in the room. So privacy is extremely important. Second is, when we talk about privacy, uh, most of the people for whom telemedication, teleconsultation works is for the rural part of the country, and they may not be using their own phone, or they may not be using their own email address to connect or reach out or receive the prescription. So I mean, these are some of the issues that we take for granted, but
Yeah.
need to be addressed as we evolve in the industry. Dr. Pari, thank you so much for taking out time today, because while we discuss patient safety and responsibility and the rights, understanding the medication safety is extremely important,
Yes.
because this directly impacts the patient outcomes. So really appreciate you taking out time this morning.
Thank you. Thank you so much for your time. Thank you for giving the opportunity.